everyone, I'm Dr. Judith Sugay. Today I'm going to discuss the continuation of the components or phases of the nursing process, which is nursing diagnosis. After conducting a thorough assessment to your client, the next thing to do is to construct a nursing diagnosis. So join me as I explain how to write a nursing diagnosis. For the learning outcomes, after completing the module, the students will be able to understand the nursing diagnosis as a component of the nursing process, explain the purposes of nursing diagnosis, identify the phases of nursing diagnosis, and be able to differentiate the types of a nursing diagnosis. Nursing diagnosis, as defined, is a complex decision-making process. It requires cognitive and intuitive skills, experience, and scientific knowledge based by the nurse. So we have here the diagnostic process. Okay, so we have input, throughput, and output. Okay, so input involves collection of the cues. Okay, so the cues here are interaction, observation, and measurement of the nurse with regard to the client's health condition. Okay, and then this information or data will be processed and interpreted. Okay, and it is called a process of throughput. And this is going to be based on the nurse's knowledge, skills, and experience. And then the output or the outcome is that the nurse should be able to identify the nursing diagnosis. So the nurse here comes up with a nursing diagnosis statement which is appropriate to the client's health condition. So what are the purposes of nursing diagnosis? So the first one is to contribute to the identity of nursing as a profession and accountability. Facilitate nurses' autonomy in judgment, about client care. Contribute to the knowledge base of nursing as a science. Contribute to the continuity of care, and provide the basis for generating computerized nursing care plans. Here are the phases of nursing diagnosis. First one is analysis. Analysis includes categorizing the data and identifying data gaps and incongruencies. Data gaps are missing data necessary to determine patterns and specific approaches according to or in relation to the health condition of your client. So, here's an example. Okay, this is your data and this one's the data gaps. Alright, so this is based on the nutritional pattern of your client. Subjective cues. The client said, I eat once a day, usually hot dog and drinks 3 to 4 bottles of soda. Objective cues. Skin folds on arms and ankles. Height is 5 feet. Weighs 300 pounds. Now, what seems to be missing in this data? Alright, so in order for you to be able to create or construct appropriate nursing diagnosis, you have to double check everything. Okay, again, take a look at your assessment. So, what does the 3-day diet recall say? Okay, and then have you ever asked the client about his or her knowledge about the basic food groups? How about the type and size of soda? Remember that the type and the size of soda will also contribute to the number or to the total calorie intake of the client. So again, given this data, you have to double check other relevant assessment or result of your assessment before you conclude about the nursing diagnosis. The second phase of the nursing diagnosis is synthesis. So, synthesis actually involves determination of patterns compared with norms and standards, health concerns, and delineation of etiologic relationships in relation to the client's condition. So, if you're able to do that, you must make sure that you are able to cluster the cues and patterns. Example, you have the Gordon's functional patterns. So if the problem is about nutritional pattern, then you also have to check health management. You also have to check perhaps cognitive in relation to the perception of the client about nutrition, about food intake. So again, you must be able to cluster or group relevant information about the pattern that you are thinking of having a problem or deviation. And then, next thing to do is for you to infer the health concerns, and then strengthen this by identifying the possible hypotheses, what are the available options, and then propose etiological relationship by identifying which cues are contributing factors, okay, and which nursing diagnosis is then would be appropriate for the data that you have. So, moving on, we have here NANDA, okay, or it's called, of course, the North American Diagnosis Association. So, this is the reference on writing a nursing diagnosis. This is actually an excellent reference on writing a nursing diagnosis. The diagnostic labels are organized into 13 domains with its definition and possible health outcomes. So, let's take a look at this one. As I've mentioned to you, there are 13 domains or patterns. So, the first one is health promotion. Health promotion is the awareness of well-being and the strategies used to maintain control of the well-being or being normal or having a normal functionality. And then next you have nutrition. Nutrition is the activities of taking in, assimilating, and using nutrients for the purpose of tissue maintenance, repair, and production of energy. Third is elimination and exchange. Okay, so it involves secretion and excretion of waste products from the body. And then next you have activity or rest. So this is the ability to perform activities to care for one's body and bodily functions. And then fifth is self-care. So self-care is the human processing system, including attention, orientation, sensation, perception, cognition, and communication. The sixth domain or pattern is self-perception or cognition. So this is actually awareness about oneself. Seventh is the role relationship. So this is the positive and negative connections between people or group of people and how those connections are demonstrated. Eight is sexuality. So this is the state of being specific person regarding sexuality or gender. Next is coping or stress tolerance. Okay, so this is actually contending with life events, life processes, and then we also have life principles. So you take a look at here principles underlying conduct, thought, and behavior about any actions, customs, or institutions viewed as being true or having an intrinsic worth. Next is safety or protection. This is actually freedom from danger, physical injury, or immune system damage, preservation from loss, and protection of safety and security. Next is comfort. Comfort is the sense of well-being or ease with one's social situation. And lastly, we have growth or development. So this is actually age-appropriate increases in physical dimensions, maturation, or organ systems. It can also deal with progression through the developmental milestones. Next, we have guidelines on writing nursing diagnosis. So, the guidelines are provided to be able to assist the nurse or student nurses in writing or validating a statement of the client's health condition or health concerns or even strengths. So, these are not actually sequential steps but are presented according to types of client's concerns, format, and validation. So, the first one is we have to determine, okay, the appropriate type of a nursing diagnosis. So, how do we do that? Okay, let's first identify the types of nursing diagnosis. So, we have the actual nursing diagnosis, risk nursing diagnosis, and wellness nursing diagnosis. So, let's talk more about these types of diagnosis in the succeeding slides. So when we say actual nursing diagnosis, we deal about the health problem, okay? Which is present, which can be felt, present at the time of assessment. And then this also is being recognized by the client. Then what could be the format of this type of nursing diagnosis? So you have here the problem, etiology, and signs and symptoms. So, for the problem, you start with the nursing diagnosis, which you can find in the NANDA. Alright? And then, take a look at the etiology. Okay, etiology are related factors. So, what seems to be present or what is being experienced by the client. And then, you connect the signs and symptoms, okay, or defining characteristics that made you say that the problem is really existing. Let's take a look at the example. So it says impaired parenting related to insufficient cognitive readiness for parenting, as evidenced by deficient parent-child interaction and inappropriate caretaking skills. So let's see once again. Impaired parenting refers to the problem. Yes. Okay, and then you have the etiology. What could be the related factor? So, related to insufficient cognitive readiness for parenting. Then what could be the evidence that made you say that it is really a problem? Okay? Or you can say if it's an illness, other signs and symptoms. But here, this is situational. So, we can say as evidenced by deficient parent-child interaction and inappropriate caretaking skills. Alright, so let's check on the other type of nursing diagnosis. We have here the risk nursing diagnosis. As described, patient that is more vulnerable compared to others. Okay? So, again, when you say risk, the problem is not there yet. But the vulnerability of the client to have such health problem is there. Or there's a chance that the client will have such health condition. Okay? So, the format here is not like the actual nursing diagnosis, which is PES, problem, etiology, signs, and symptoms. Here, the format is problem and risk factor. Okay, so we have here, for the problem, start with the nursing diagnosis. Again, this can be found in the NANDA. Okay, and then, what could be the risk factor? The risk factor, again, this is not an actual symptoms, an actual event that's being experienced by the client. So, let's have the example. For the problem, okay, problem statement, we have risk for ineffective relationship related to, then that is now the risk factor, okay, related to, again, I repeat, substance misuse of the partner. So, this is not, again, a problem that is experienced or being experienced, but then again, the client is at risk of experiencing this one. Okay? Next, we have the wellness nursing diagnosis. So this is a positive statement of the client's health condition. It indicates that the client is coping and functioning adequately. So we have here the format of problem and related factors. So take a look at the format. You do not look for PES because there's no signs and symptoms. So what is again PES? Problem, etiology, and signs and symptoms. So going back to wellness, the format here is problem and related factor. So for the problem, start again with the nursing diagnosis. So take a look at the NANDA, yes. And then for the related factors, review the associated positive factor of the wellness condition. So, let's take a look at the example here. Readiness for enhanced parenting. So, that is the problem statement, as evidenced by expressing the desire to enhance emotional support of children. So, that is the related factor. So, that is the wellness nursing diagnosis. So let's now continue with the guidelines on writing the nursing diagnosis. For the second step, nursing diagnosis is written as descriptive and etiological statement. So when we say descriptive, again, the first part of the statement, as you can recall a while ago in the given examples about the different types of nursing diagnosis, the first part of the statement is descriptive. It actually identifies the client's response to an actual or potential health problem, disturbance in life processes, patterns, functions, or development. This is the specific label for the response, and maybe, again, you have to check the NANDA. But then again, when you check the NANDA, make sure that you are having the appropriate or related cues, okay, so that you can easily identify the appropriate nursing diagnosis. So an example of this one is altered patterns of urinary elimination. So that is descriptive. Okay. So let's take a look at the second part, okay? The second part of the statement is the etiology. So again, we are still on the second on the second step. Okay. So in the etiology, this states the contributing factor or factors if the about the client's health concern. So this indicates the nurse's perception of the probable causative factor or factors and must follow flexibility and exploration. So the client's concern may be influenced by several factors. It could be physiological, such as fluid deficit or fluid excess, psychological like fear, anxiety, low self-esteem, social, language, finances, support system, environmental, odors, lighting, noises. So, an example of this one is sleep pattern disturbance related to fear of impending surgery, noisy environment, and pain. So, again, take a look at take a look at the relative or the factors, okay, etiological factors. So based on the assessment of the nurse, these are actually the factors that's causing the sleep pattern disturbance of the client. So, in writing the nursing diagnosis statement, again, it can be written as a three-part, okay, three-part statement where you are going to connect the descriptive, etiological, and clustered cues, okay? So, do not forget to include the term or the words related to in order for you to be able to connect the clustered cues, okay? So, this is again when writing, huh? Alright, so an example would be anxiety related to hypertension hospitalization as evidenced by restlessness. So, the descriptive and etiological parts of nursing diagnosis statements are connected with the words related to in order to indicate the relationship between the health concern of the client and the contributing factor or factors about the health condition. So, in writing the nursing diagnosis, make sure that it is concise and clear. So, clarity and conciseness facilitate communication among peers and health team members. Remember that nurses endorse the condition or the health condition of the patients. Okay, so in order for you to be able to be understood by your peers, then you must make sure that what you have written about the client's health condition, nursing diagnosis is clear and concise. So, in order for you to do this one, you are to use the NANDA, okay, so that you will be able to identify appropriate nursing diagnosis statement. Then, the statement should reflect a particular cluster of cues that is, again, indicative of that label, of what you have written. And then, the following, actually, you have several terms, okay, that can be helpful in writing unlisted nursing diagnosis. When we say unlisted, there are, in some situations or conditions, there are words or terms that cannot be found in NANDA. At any rate, you are still, you can still do something about it. You can still use other words, okay? So, these are the terms that could be helpful in writing nursing diagnosis which are unlisted, like alteration in, potential for, lack of, inadequate, and then you can also make use of the adjectives, okay? To allow nurses to prioritize certain conditions like mild, severe, intermittent. Okay, so these are adjectives rather, so that you will be able to know which nursing diagnosis should come first. Okay? And then, the nursing diagnosis is client-centered, specific, and accurate. Okay? Client-centered diagnoses are stated in terms of the client's response to intrapersonal, interpersonal, and environmental stressors. So, we have here correct or incorrect and correct examples. So, let's see. Okay, cluttered home maintenance management. So here, again, as you can recall, in doing the nursing diagnosis statement, it has several parts depending on the type of nursing diagnosis that you have identified. So basically, this is not correct because it doesn't follow such format, right? Whereas the next statement, impaired home maintenance management, related to insufficient family organization as evidenced by disorderly surroundings and accumulation of dirt is indeed correct. So remember, you have the nursing diagnosis statement there, and then you have the etiological factor or influencing factors here, and you have the evidence or the cues that could really support your nursing diagnosis statement. Okay, so the next step is the nursing diagnosis provides direction for nursing intervention. So it is very crucial to be able to identify or construct the appropriate nursing diagnosis, because again, that's going to be the basis for your care for the client, and that is through nursing intervention. So if the nursing diagnosis says that there is a potential for injury related to home safety hazards, then most likely, of course, the nurse will create a list of interventions, okay, that could prevent harm to the client. So the nursing intervention could be methods of helping the client decrease or eliminate eliminate the safety or unsafe environment. Okay, so next is, okay, let's now find out how well have you learned. Alright, so which of the following nursing diagnosis is correct? Okay, so again, I repeat, which of the following is a correct nursing diagnosis statement? A. Myocardial infarction related to high cholesterol level as evidenced by chest pain. Myocardial infarction, by the way, is also known as heart attack. Okay. So next is B is fluid volume deficit related to vomiting. And then C, sleep pattern disturbance as evidenced by frequent awakening episodes at night. So, what do you think, okay, is the correct statement here? Okay, so if you answered sleep pattern disturbance as evidenced by frequent awakening episodes at night, then you are correct. Okay, so again, you have here the nursing diagnosis statement, okay? And then you also have the etiologic factors, okay? And then it's actually signs and symptoms. There's frequent awakening episodes at night. So, as you can notice, why is it that statements A and B are not correct? It is because these are not nursing diagnosis but medical diagnosis, because of the terms of myocardial infarction, fluid volume deficit. So there is more there is more information needed to be able to make this or convert this to a nursing diagnosis statement. A problem that again a nurse can act about it. So in doing the nursing care plan, again, as if you can remember, during the assessment phase, okay, we mentioned that for the assessment, you have to indicate the assessment IOM or interaction, observation, and measurement under the first column, which is about the cues. Okay, so that still remains the same. Okay, cues are subjective, that's interaction, objective cues, observation or measurement, and then you add what we have learned today, which is nursing diagnosis. So here you are going to make sure that the health condition is based on the cues, okay? It is related to the cues, and then again, you have to make use of NANDA as your reference and identify related or factors associated to the condition, or again, related factors to the immediate cause of the client's condition. And then here also, we've mentioned the phases of nursing diagnosis that we include synthesis. So in synthesizing, you are to include that in the third column, which is under analysis. So you have to explain here the nursing diagnosis. You just have to describe, and then also you can present the underlying pathophysiology of the patient's condition if that's the case, and then of course you cite your reference. So what's going to be reflected here are information, details about the causative factor, okay, or etiological factor in relation to your nursing diagnosis. Alright, so we will talk about the remaining columns here as we discuss, again, several components or phases of the nursing process. Alright, so my references are Berman, Coshier and Erb's Fundamentals of Nursing, and Nursing Process Application of Conceptual Models by Christensen and Kenny. Okay, so once again, thank you for participating and listening well. I hope to see you in our synchronous class. Bye everyone!